Dear student, I am Dr. Prakash Mungli, Professor of Biochemistry. So in this particular video, I will be explaining all about metabolism of galactose and applied clinical aspects. So I will be getting into some of the important enzymes that are involved in metabolism of galactose and also disorders like galactokinase deficiency and classic galactosemia. Let's get into the details. Now the source of galactose for us is lactose in the food, and the lactose when we get in the food, so it will be digested in the intestine because we have a intestinal lactase enzyme which is also called as beta-galactosidase enzyme. And the lactase enzyme, what it does, it is going to break a beta-1,4 bond that is linking glucose and galactose, and by breaking beta-1,4 bond, glucose and galactose are released in the intestine, and this glucose and galactose is absorbed into the enterocyte, and like that galactose gets into our body. Now the entry of galactose into the cell, like fructose, is not insulin dependent, whereas glucose entry into most of the tissues, especially skeletal muscle, adipose tissue and cardiac tissue, is insulin dependent, whereas galactose and fructose, they can simply get into the cells by facilitated transport mechanism. Okay, so these are insulin independent transport of galactose. Now galactose is predominantly metabolized in the liver because galactose getting into the portal circulation, it is taken up predominantly by the liver, although other tissues can take up galactose, and that includes red blood cells, lens, it can include a brain. So they can also participate in galactose metabolism. So what happens to galactose in the liver? So it all depends on what is the dietary status of the person when galactose is consumed. If the person is in relatively fasting condition and if the milk is consumed to break the fast, so at that time a liver converts galactose into glucose, right? Otherwise galactose can be converted into glucose 1-phosphate, and glucose 1-phosphate can be getting into glycolysis process. And the fate of galactose in other tissues is to go into glycolysis only, because other tissues cannot make glucose from galactose. We are going to see that as we move on. Okay, so these are some of the points that you need to remember related to galactose, that how that galactose gets into our body and what are the organs that metabolize galactose. Okay, it is the lactose which is the source for galactose. Lactose breaks into glucose plus galactose, and that is done by lactase enzyme, which is a brush border enzyme which breaks a beta-1,4 glycosidic bond, and galactose glucose gets into the cell, and inside the cell galactose is metabolized into either glucose in the liver or glucose 1-phosphate in the liver and other peripheral tissues. Now let's get into galactose metabolism. Galactose is phosphorylated at its first carbon into galactose 1-phosphate by using ATP, and ATP is consumed here, and ATP is released as ADP, and the terminal phosphate of ATP is attached at the first carbon, and this reaction is catalyzed by galactokinase enzyme. Now this galactose 1-phosphate, it is undergoing a reaction catalyzed by an enzyme called galactose 1-phosphate uridyltransferase, and simply we can just remember it as GALT enzyme, galactose 1-phosphate uridyltransferase enzyme. What this galactose 1-phosphate uridyltransferase does, as it is shown here in the figure, it is going to condense galactose 1-phosphate with the UDP-glucose. UDP-glucose is getting into this reaction where it is going to give that glucose molecule to galactose 1-phosphate, and the phosphate present in the galactose 1-phosphate will be transferred to glucose by galactose 1-phosphate uridyltransferase enzyme, and we get glucose 1-phosphate there, and galactose will be transferred to UDP, so you get UDP-galactose. This is how the transfer will go on. Let me highlight that. So the phosphate that is attached to galactose 1-phosphate will be given to glucose, and that's when glucose is now converted into UDP-glucose is now converted to glucose 1-phosphate. That's how the transfer is going on. The phosphate from galactose 1-phosphate transferred to UDP-glucose, and bond breaks. Glucose is now released as glucose 1-phosphate, and now the galactose, it is attached with the UDP. Now I'm going to color that differently. So the galactose part of galactose 1-phosphate will be attached with UDP of UDP-glucose, and it will be released as UDP-galactose. So this is how a transferase enzyme, galactose 1-phosphate uridyl-transferase, that's how it transfers it. Okay, the phosphate from galactose 1-phosphate given to glucose of UDP-glucose to make glucose 1-phosphate, and galactose is now transferred to UDP to make UDP-galactose. Now your galactose, which gets into the metabolic pathway, is now present in the form of UDP-galactose. Now this UDP-galactose will be converted into UDP-glucose. Okay, so conversion of UDP-galactose into UDP-glucose is done by epimerase enzyme, 4' epimerase, because it catalyzes epimerization reaction. Why? Because glucose and galactose are 4 epimerase. They differ in 4th carbon. Okay. Now UDP-galactose, this is how it is converted to UDP-glucose, and this UDP-glucose, when it gets into the next galactose metabolism, always remember, you need UDP-glucose in galactose metabolism. Very first UDP-glucose for very first galactose metabolism will come from glucose 1-phosphate. Glucose 1-phosphate converted to UDP-glucose, and that gets in. So that is the original glucose there in the very first metabolism of galactose. In the second metabolism of galactose, okay. So let me show that to you separately just to avoid confusion. So what I am trying to say here is, so initially glucose 1-phosphate is the one that is converted to UDP-glucose, and UDP-glucose is the one that is getting into galactose metabolism. Okay, at this time, so let me just take this out so that it will avoid the confusion. Now, so the transfer reaction going on where, so I'm going to color galactose as green here. So galactose is converted to galactose 1-phosphate. Okay, so I'm going to color that galactose 1-phosphate, only galactose I'm boxing it as green. So galactose 1-phosphate interacting with UDP-glucose done by galactose 1-phosphate uridyltransferase. So the phosphate present in UDP-glucose, okay, it will be transferred to UDP-glucose there, so becoming glucose 1-phosphate. Okay, so I'm coloring glucose as red, glucose red here, original glucose. Now you have glucose 1-phosphate there. Now what happened to the galactose? So galactose is there in the form of UDP-galactose. Here is your galactose. Okay, it is there in the form of UDP-galactose now. What happened to this UDP-galactose? UDP-galactose will be converted into UDP-glucose. I'm going to write that separately now. So UDP-galactose converted to UDP-glucose, and that is done by 4' epimerase. Now this UDP-glucose, so galactose is there in the form of glucose now, UDP-glucose. The galactose carbons are there in the UDP-glucose form. Now this UDP-glucose goes into second galactose metabolism. Now the second galactose, I am going to color it a little differently, so that I will use this color here, galactose. Say this is the second galactose converted into galactose 1-phosphate, and this galactose 1-phosphate is undergoing a GALT reaction, galactose 1-phosphate uridyltransferase reaction, where UDP-glucose goes in. Now this UDP-glucose gets into the reaction, transfer reaction, and now it will, let's see what are the result molecule that comes out. Now the galactose 1-phosphate going into galactose 1-phosphate uridyltransferase reaction, where UDP-glucose is getting into the reaction. So at that time the phosphate is transferred to UDP-glucose, becoming glucose 1-phosphate. Glucose 1-phosphate. Okay. And now the galactose is coming out as UDP-galactose. So UDP attached to UDP-glucose there, UDP-galactose. UDP-galactose. Now this is what happened now. Now the second molecule of galactose is now in the form of UDP-galactose, and the very first galactose which got into very first galactose metabolism, now it is in the form of glucose 1-phosphate. So the galactose is now in the form of glucose 1-phosphate. This is how it goes. Now what happened to that glucose 1-phosphate here? This glucose 1-phosphate can be converted into glucose 6-phosphate, and this glucose 6-phosphate has 2 fate. In the liver it can be converted into glucose because we have glucose 6-phosphatase enzyme in the liver, or it can go into glycolysis in the liver and other tissues. In the other tissues, the fate of glucose 1-phosphate is only to go into glycolysis, whereas in the liver it can either go into glycolysis or it can go into conversion of glucose, right? And this is how ultimately galactose that gets into this metabolic pathway, in its second galactose metabolism, it will go into glucose form. This is how every time UDP-galactose converting into UDP-glucose gets into second galactose metabolism. So overall, we are in our cells, galactose is converted into glucose 1-phosphate. That is what is shown here in this particular figure. So let me erase what I have written, and so that you will see only the simplified diagram that has been used here. Okay, so see here, galactose 1-phosphate is converted into glucose 1-phosphate. Galactose 1-phosphate converted into glucose 1-phosphate. This happens in the second galactose metabolism. I explained you that. And that glucose 1-phosphate can be converted into glucose 6-phosphate done by phosphoglucomutase enzyme. Phosphoglucomutase. And that glucose 6-phosphate can go into glycolysis, or this glucose 6-phosphate can convert into glucose, and that will be done by glucose 6-phosphatase enzyme. Glucose 6-phosphatase, right? So this happens in the liver. This happens only in the liver, and glycolysis can happen in liver and non-hepatic tissue. So this is what is the fate of galactose in the liver and other tissues. So we have a few enzymes here to remember. So one is galactokinase, which is catalyzing very first reaction where it is phosphorylating galactose into galactose 1-phosphate by consuming ATP. Second is galactose 1-phosphate uridyltransferase. It is condensing galactose 1-phosphate with UDP-glucose to make glucose 1-phosphate and UDP-galactose. UDP-galactose is converted into UDP-glucose by 4-epimerase by epimerization reaction, and that's how the galactose carbons are converted into glucose carbons. And then in the second galactose metabolism, this glucose, UDP-glucose, will become glucose 1-phosphate, and that glucose 1-phosphate goes into glycolysis by forming glucose 6-phosphate, and that is done by phosphoglucomutase enzyme. And now whenever there is excess galactose available, whenever there is excess galactose are taken in, or if there is any defect in the galactose metabolism pathway, some of this excess galactose can be diverted into galactitol formation, galactitol, and that is done by enzyme aldose reductase. Aldose reductase enzyme, it is going to use NADPH plus H plus in the conversion of galactose into galactitol, and galactitol, it is an osmotically active molecule. Osmotically active, that means when it accumulates in the tissue, in the cell, it's going to bring in water and make the cell swell and leads to metabolic abnormality and ultimately breaking the cell. So it can lead to cell death, right? So excess galactitol is a bad thing because it leads to metabolic changes in the cell and altering the cellular metabolism. So this is how the enzymes which are catalyzing the conversion of galactose into galactose 1-phosphate and further down are involved in galactose metabolism. So this is the slide that explains you all the reactions that I have explained so far in the previous slide. Just to recap, so we have galactose getting into galactose 1-phosphate formation, and that is done by galactokinase enzyme where ATP is used. Remember that, and galactose 1-phosphate as the phosphate. Make sure you remember that. Now, galactose 1-phosphate undergoes a reaction catalyzed by galactose 1-phosphate uridyltransferase where galactose carbons are converted into UDP-galactose now. Now, the UDP-galactose further down it will be converted into UDP-glucose, and that is done by 4-epimerase. Now, the galactose carbons are present in glucose carbon, UDP-glucose, and this UDP-glucose it can go into second galactose metabolism and be converted into glucose 1-phosphate. So I am going to color that as glucose 1-phosphate here. So what happens to the glucose 1-phosphate? Glucose 1-phosphate is converted to glucose 6-phosphate by phosphoglucomutase enzyme, and the glucose 6-phosphate has two fate. In the liver, since we have glucose 6-phosphatase, so it can be converted to glucose, or mostly in other tissues, so including the liver, glucose 6-phosphate largely it will go into glycolysis. That's why the big arrow that you are seeing there. Okay. Now, glucose UDP-galactose. Let's look at UDP-galactose. UDP-galactose, it can also go towards lactose formation. UDP-galactose converted to lactose formation done by lactose synthase enzyme. Because UDP-galactose can be condensed with glucose to become lactose. Lactose synthase enzyme, it is going to make a beta-1,4 glycosidic bond to make lactose, and that's how lactating mammary glands will synthesize lactose. So lactating mammary glands will express lactose synthase and make lactose. And also UDP-galactose can go into glycolipids, glycoproteins and glycosaminoglycans formation. Now let's move on to see what if there is a deficiency in one or the other enzymes involved in galactose metabolism. So first we will see what if there is a deficiency of enzyme, that is galactokinase. Very first enzyme in the galactose metabolism is a galactokinase enzyme, and what if there is a deficiency of this enzyme? So it leads to what is called as galactokinase deficiency. It is there in the name, deficiency of galactokinase. So it's a rare autosomal recessive condition which will lead to elevation of galactose, and this galactose which is building up in the blood, means initially in the tissue and later in the blood, giving rise to galactosemia, and since it's a water soluble molecule, so it appears in the urine leading to galactosuria. Not only that, the galactose which is accumulating in the tissue is slowly diverted into galactitol formation, and galactitol increases, and this increase in galactitol may lead to metabolic abnormalities in a cell, especially in the lens. It will give rise to opacity in the lens leading to cataract. So the bilateral cataract that you see in galactokinase deficiency is because of accumulation of osmotically active galactitol molecule which is made by aldose reductase activity. That's about galactokinase deficiency. Now coming to classic galactosemia. So deficiency of second enzyme in the galactose metabolism, that is galactose 1-phosphate uridyltransferase enzyme deficiency, will give rise to a classic galactosemia. Again, it's an autosomal recessive condition, and in classic galactosemia what happens? There will be buildup of galactose 1-phosphate. So this galactose 1-phosphate, as you see here, there is inorganic phosphate there. So that means there is a trapping of inorganic phosphate, and because of this trapping of inorganic phosphate, because of the continued accumulation of galactose 1-phosphate, where the phosphate in the ATP is now trapped there as galactose 1-phosphate. So this leads to decrease in the available inorganic phosphate in the cytoplasm. and all the processes that are dependent on inorganic phosphate, they will decrease. Like what all the processes, metabolic processes that are dependent on the inorganic phosphate. And just to say in brief, the metabolic processes that are dependent on available inorganic phosphate is electron transport chain, which needs inorganic phosphate, especially at ATP synthase enzyme to make ATP synthesis. Other process is glycogen degradation. Glycogen degradation needs inorganic phosphate because glycogen phosphorylase needs inorganic phosphate to break glycogen. Other is gluconeogenesis. Gluconeogenesis indirectly needs inorganic phosphate because inorganic phosphate is necessary for electron transport chain to make ATPs, and ATPs are absolutely necessary to make to run gluconeogenesis, to make new glucose molecule. So that this can be affected. And also note that whenever galactose 1 phosphate is building up, so lack of electron transport chain running there because of lack of inorganic phosphate, and that leads to increase in NADH levels in the matrix of mitochondria because electron transport chain is not oxidizing them. So increase in NADH levels means it will have a negative effect on TCA cycle. So there will be decrease in TCA cycle. Decrease in TCA cycle means acetyl-CoA is not oxidized. So that will lead to decrease in the oxidation of acetyl-CoA because it will have a negative effect on an enzyme called pyruvate dehydrogenase complex. So increase in NADH levels, the consequence of increase in NADH level means it will have a negative effect on TCA cycle, and negative effect on TCA cycle means the acetyl-CoA will build up, and increase in acetyl-CoA will have a negative effect on an enzyme called pyruvate dehydrogenase complex, which is converting pyruvate into acetyl-CoA. So decrease in PDC, pyruvate dehydrogenase complex activity. So decrease in PDC means pyruvate will build up. So there will be buildup of pyruvate, and that pyruvate is diverted now into lactate. So there will be increased accumulation of lactate, giving rise to lactic acidosis. So patients with classic galactosemia may show lactic acidosis. And also this glucose 1 phosphate which has built up, it will have a negative effect on phosphoglucomutase enzyme. So as you see here, so phosphoglucomutase is the enzyme that will convert glucose 6 phosphate into glucose 1 phosphate or glucose 1 phosphate into glucose 6 phosphate. It's a reversible reaction. So in the synthesis of UDP-glucose, so we need to convert glucose 6 phosphate into glucose 1 phosphate in a reverse way, and that glucose 1 phosphate will be converted into UDP-glucose as it is shown here. If you read this going from like this, from glucose 6 phosphate to glucose 1 phosphate and then into UDP-glucose, and that UDP-glucose is used for glycogen synthesis. It is also used for conjugation, for bilirubin conjugation. Bilirubin conjugation uses UDP-glucuronate, and that UDP-glucuronate will come from UDP-glucose, right? So this is how conjugation of bilirubin can be affected. Glycogen synthesis can be affected having low glycogen in these patients. So that conjugation of bilirubin which is affected here will lead to buildup of unconjugated bilirubin in the blood, and that can lead to jaundice. And also trapping of inorganic phosphate, altering the metabolic pathways in the liver and other tissues may lead to metabolic abnormalities as such. It can lead to liver damage, it can lead to jaundice, it can lead to hepatomegaly, overall leading to liver failure. So, and also the abnormality in galactose metabolism in the brain can lead to mental retardation. So, and galactitol which is building up because of galactose 1 phosphate which is accumulating here, and trapping of inorganic phosphate ultimately will decrease ATPs, and ATP level because electron transport chain is done, down, and then lack of ATP means galactose is no longer converting more and more into galactose 1 phosphate. So galactose builds up. That's why it leads to galactosemia in classic galactosemia. and that galactose will go towards galactitol formation. And that's how in classic galactosemia, patient will also show bilateral cataract. So like this, one single enzyme being deficient will lead to so many metabolic consequences, and that you must be aware of. So this is how knowing the biochemical pathways can be used to understand metabolic disorders and even to understand why certain signs and symptoms are seen in these metabolic disorders. Okay, so that's in brief about how metabolic diseases can be caused because of deficiency in one or the other enzyme in this metabolic pathway. Now let's get into disorders related with galactose metabolism. Little more information than what I have already explained you. Most of it I have already explained you in this slide, in the previous slide. Now I will just review whatever I have explained earlier. Now, galactokinase enzyme deficiency is because of deficiency of galactokinase. The name of the enzyme disease itself is galactokinase deficiency. Enzyme deficient is galactokinase. So what happens in galactokinase enzyme deficiency? It is galactose which is converted into galactose 1-phosphate. So that is done by galactokinase enzyme. Now the galactokinase enzyme is down, so it is deficient. That will lead to elevation of galactose, and this elevated galactose appear in the blood, and that's why patient will have excess galactose in the blood, leading to galactosemia, and this galactose appear in the urine, leading to galactosuria. And also not only that, this excess galactose is diverted into galactitol formation, galactitol, and this is done by aldose reductase enzyme. So this galactitol which is building up in the tissues will lead to metabolic abnormalities, and especially if it is building up in the lens, galactitol can lead to alteration in the lens, leading to opacity in the lens called cataract. So patient will show bilateral cataract, bilateral, because it's a systemic condition. So cataract seen on either side of the eyes, bilateral cataract. So bilateral cataract is because of increased levels of galactitol, and that's because of aldose reductase activity. So patients with classic galactokinase deficiency generally do not show liver damage or no mental retardation. So now treatment is simply dietary restriction of milk and milk products will take care of the signs and symptoms. So only abnormality, means only visible sign that you see in galactokinase deficiency is patient will show bilateral cataract most of the time. Coming to classic galactosemia. Now the classic galactosemia is because of deficiency of galactose 1-phosphate uridyltransferase enzyme. And because of this, what happens, as I explained previously, there will be buildup of galactose 1-phosphate in the tissues. And this galactose 1-phosphate has got that inorganic phosphate. And that inorganic phosphate is now stuck there, it is trapped. So there is a trapping of inorganic phosphate, trapping or sequestration of inorganic phosphate. I'll write it as PI. And since there is a sequestration of inorganic phosphate, so that will lead to decrease in electron transport chain. It will lead to decrease in glycogenesis, decrease in glycogenolysis, that is breakdown of glycogen, decrease in gluconeogenesis, increase in lactate formation. All these I have already explained to you. And also there will be increase in unconjugated bilirubin, and that leads to jaundice. And also buildup of inorganic phosphate will lead to damage to the liver, so giving rise to liver damage. Patient may show liver damage, hepatomegaly, and Changes in the galactose metabolism in the brain ultimately will give rise to mental retardation. So all these signs we are going to see in classic galactosemia because of deficiency of galactose 1-phosphate uridyltransferase enzyme. And also note that patients with classic galactosemia may show hemolysis. So hemolysis is another sign that you will see in classic galactosemia, red blood cell, RBC lysis. Why a patient shows RBC lysis? It is because the excess galactose, it can have an inhibitory effect on glucose 6-phosphate dehydrogenase enzyme, which is there in the pentose phosphate pathway, thereby decreasing NADPH. And decrease in NADPH means decrease in glutathione, and that decrease in glutathione may lead to increase in RBC lysis. Okay, so these are some of the things, metabolic abnormalities that you see in galactose 1-phosphate uridyltransferase enzyme deficiency. So it is a bilateral cataract because of increased, so that is also another sign that I would like to add here. So there will be bilateral cataract. Why there is a bilateral cataract here? Because accumulated galactose is diverted into galactitol formation by aldose reductase enzyme. So patient showing bilateral cataract, patient show fasting hypoglycemia because of decrease in glycogenolysis, decrease in gluconeogenesis, overall not maintaining glucose levels under fasting condition. Hyperuricemia, why patient shows hyperuricemia? Because more and more purines are undergoing degradation just to provide inorganic phosphate. So uric acid levels will increase. Jaundice, because of increase in unconjugated bilirubin there. Mental retardation. So these are all the signs of classic galactosemia. Note that if a child, if a patient is aged less than 1 year or less than 2 years, where mental retardation is not clinically proven, so at that time we will have to look for bilateral cataract, hyperuricemia signs, increase in unconjugated bilirubin, hepatomegaly, liver failure, fasting hypoglycemia. All these signs will help in the diagnosis process. Okay, so some of those enzymes that I have written, that I have explained before is given here. Excess galactose 1-phosphate, which inhibits phosphoglucomutase, decreases UDP-glucuronic acid, leading to increase in unconjugated bilirubin. Now, how do you do the diagnosis? Diagnosis is done by noting the presence of reducing material, that is reducing sugar in the urine but giving a negative glucose oxidase test, because glucose oxidase test is for determining glucose in the urine, whereas here since galactose is elevated, galactose is also a reducing sugar, it will answer for Benedict test but it do not answer for glucose oxidase test. So it is negative for glucose oxidase test, positive for Benedict test, indicating there is a reducing sugar but it's not glucose, right? Because glucose oxidase is negative. That's how we can do the diagnosis, and also we can directly determine galactose 1-phosphate uridyltransferase activity in the red blood cell. Now treatment is restriction of dietary galactose. Synthetic diets like soya milk which are free of galactose is also recommended. So that's about galactose metabolism, all the enzymes that are involved in the conversion of galactose into all the way into glucose 1-phosphate we have seen, and also deficiency of one or the other enzymes in this metabolic pathway we have also discussed in detail. So that's about galactose metabolism. I hope this video has helped you in understanding the concept. Thank you.